COVID-19 has shined a light on something that has always existed in this country: inequities in health coverage based on race. The virus may not discriminate, but people of color are when it comes to how their health is treated. Fox 43's Matt Maisel explains why these biases in healthcare exist and what's being done to fix it.
I think that before you identify why a problem exists, you have to be aware of the problem.
The numbers are pretty clear that particularly in the African American community, deaths have ravished as a result of COVID.
So you will find gaps in the way we care for our patients and gaps in their eventual outcomes.
Closing those gaps when it comes to racially based inequities in our healthcare system can take years and a lot of understanding.
As a person who is not a person of color, one of the first things that I have needed to do and continue to need to do is to listen and to learn.
Chastity Frederick is a nurse with the York City Health Bureau. She says more than half her patients are people of color.
I empower people to advocate for themselves and to advocate for their families. Lots of people say, well, I don't understand the health lingo. I don't understand, what this means. And that's okay, but it's okay to ask questions.
So we look at the community and say, well, what's wrong with this community that they're not getting X, Y, and Z? They're not getting the care.
Dr. Jaya Isola and her colleagues at Penn Medicine are trying to figure out why. Dr. Isola runs Penn's Center for Health Equity. Their studies show fixing race-based discrepancies in healthcare starts in their own house.
One of the things we did here at Penn was we looked at the way our providers and med students are being trained in terms of the way race is used and the way we use race and think about race and the way we define race-based differences in health outcomes and healthcare. And if we address some of that as a medical community, can we sort of move the needle?
According to the Association of Medical Colleges, Black doctors make up just 6% of all practicing doctors in America, as opposed to white doctors who make up 56%.
It's heartbreaking because, as you mentioned, we recognize that Black patients tend to do better when treated by someone who looks like them.
Our sister station, WCNC in Charlotte, recently spoke with a husband and wife doctor duo about healthcare inequities.
A recent study by Stanford University found Black doctors who treated Black patients were more inclined to write detailed notes, give a clear understanding of a diagnosis, and provide holistic approaches to curing illnesses.
A Black patient comes in and they're dealing with high blood pressure, then, it may not just be, let's throw a medication at you. It may be, okay, well, let's talk about what's going on in the home. Let's talk about what you're eating every day. Let's talk about some of the stressors that you're experiencing as we live in this, highly racially charged society.
Last summer, State Representative Jake Wheatley of Pittsburgh proposed legislation to address the health inequities in people of color. The bill would create a racial equity task force within the Department of Health to address systemic racism in all Pennsylvania communities.
People of color live all across the Commonwealth. They're not just in urban settings, they're in rural communities as well in each corner. So we don't want to leave any of our Pennsylvanians at risk.
House Democratic leader Joanna McClinton expects Wheatley's bill to be reintroduced soon. She hopes it addresses issues like this study from Dr. Isola's team. They found Black babies are twice as likely to be born preterm, and in York, it happens to nearly 1 in every 6 Black mothers.
Do you think we're doing a better job as a society, of being aware of the issue?
A better job, yes. Do I personally and professionally believe we're there yet? No.
Matt Maisel, Fox 43 News.